high-level summary of the course that we went through this morning on Foundations in HCI Research and Design. I'll talk about the process, then I'll give an example of a healthcare rural facility project that we conducted. Then I'll go through the design process and the iteration, testing and deployment. Finally, we'll talk about the plan for the week. Human-computer interactions helps us design user experiences that can support scalable solutions. The last part is added just because we are working in developing settings, but look at human-computer interactions in terms of understanding humans to design technology that can help them in their context. A simple example that we're going to use consistently is that M-Pesa Money app is able to be used by different sets of populations in Kenya. Our parents, ourselves, and our grandparents are able to use M-Pesa effectively to send, receive money, and pay for services. In the broad context, in this photo, you can see the picture of a human and a computer. The study of how people use technology, which is symbolized by the computer here, in a way that supports them is what we refer to as human-computer interactions, otherwise called as HCI. Now, today in our class, we were able to coordinate different sets of technology. I was able to present from my laptop. Then at the hub, Ted was able to connect this presentation through a screen, and all the team was able to share it. Other team members were able to log in using their computers, including other people who did that remotely. That is called computer-supported collaborative work. So the study of how digital technologies help people work together, for example, help us conduct this lesson together, that is an aspect of human-computer interaction that is called computer-supported collaborative work. Finally, you have a context. The context is designing the technology for people to use it in their local settings. And you'll see here that the social practices and behaviors. The social practices and behaviors, for example, the things we do every day, if I'm a student, if I'm working, if I'm a researcher, those practices that we do every day, or if I'm a farmer or someone selling technology. Today we use the example of a woman who is selling produce at the local market. Studying their social practices and how they go about their daily business is to understand their everyday routines is what is used to inform the design of technologies that can support them. So again, M-Pesa can be used, and you can, as these people do their activities during the market, during the selling and all this stuff, the study of how they pay for goods and services using technology would be a contextual practice, which means it would be studying how technology helps them sell produce. So that is what we mean by understanding the social practices and behaviors of users. Then we came to this diagram, and this diagram connected all these aspects that are required to understand the approach of human-computer interaction. At the top, we have users, and we used two examples. We used examples of our parents and ourselves, but we also used the example of someone selling produce. When we understand these users and the challenges they are facing when using technology, and they provide feedback, we get to design solutions that can help solve those challenges they're mentioning. Once we design the challenges, we build prototypes or simple representations that people can interact with. They can touch them, they can click them over the web, and this is interaction. So that step connects users who are humans to prototypes through interaction. And then when you iterate, so testing, and you get feedback, more feedback, we are down at the prototype, then you are able to build an application. The application is represented by the computer. So this gives us humans, users, computers, application, interaction, interacting with the prototypes, which is the application. The whole process is connected through feedback and testing. So finally, we said human-computer interaction studies how people use technology in real context to inform better, more usable designs. Here I gave the example of M-Pesa. In the beginning, when you used to send money with M-Pesa and you sent it to the wrong person, there was no way to get it back. You had to call the person who you sent the money to and ask them to return the money. Sometimes this wouldn't happen, other times it would happen, and other times people would lose money. The feedback was sent back to Safaricom, and Safaricom was able to add a functionality where nowadays you are able to reverse transaction. That is a classic case of how technology was designed to support people avoid losing money. So in the context today, we also gave an example of a healthcare facility. And this is an application that was built and research that was conducted in a healthcare facility. Is a project that I worked on a few years back. But it was relevant to show locally how we used human-computer interaction research process to design a technology that was deployed in the facility. So the health facility is a rural health facility. It was in Migori, Kenya. And also this touches to the projects we will do this during this week. We need a context around the work that we are doing. So why would this organization where I was working for do a research with these health facilities? So there has to be synergy. The health facility had successfully used technology in managing HIV. They wanted to transfer these skills to the design, to the management of hypertension. The organization I was working for was looking to design technology in healthcare. Hypertension was a big problem, so these two organizations had shared interest in these types of research. So that is how you collaborate. Then we said during the week, the teams will work together and you'll work together, but the main goal will be a research goal. What problem are we solving? This has to be written down because it will guide how the team works. The human-computer interaction methodology is captured here in 3 iterative steps. On the left, we have step 1, which involves speaking with users to get information, and you collect some notes. You will do an analysis of these notes and it will be an input to the healthcare technology that you want to build, which is at the bottom. Once you have this input, then you get into designing. Designing aims to get to build an application that solves a problem. The problem has been captured in step 1. You build a prototype and give it to users to test it. That is also an input to the final technology. That input, which we are saying is a prototype, is also shared with the users who give feedback, and then you iterate on it and now build an application. The application is iteratively improved using user feedback. This is captured in form of notes, videos, recordings, and this is continuous improvement. And the simple example you can use here is M-Pesa. People would send the money to the wrong people, but then Safaricom added a security measure. So today that problem has been solved. So that is continuous improvement of the problem. So the first step, which is getting research or collecting information from users, guides the next steps of human-computer interaction methodology. So we'll talk about how you conduct user interviews. I mentioned this research was done in the health facility, and because this is a summary, I'll just go through it quickly. We found that health practitioners required certain information to understand the challenges that people with hypertension were facing. Information supported treatment decisions. So this is what this basically meant, that if one had hypertension, their history of treatment was important. So if somebody went to a facility without the records, this was more difficult to solve because then you have to start from zero. Capturing patient data is important. Even today, all of us, when we go to the clinic, we always have patient records. We are encouraged to go to the same clinic. If we go to different clinics, our records disappear, and every time we start afresh. So technology that aggregates our health clinic is important. That information provides knowledge to the healthcare facilitator, and they are able to give you treatment quickly. So in the research, I also mentioned that we capture the pictures about the context, And here we can see a health facility in rural Kenya where you can see medication and there's also a clinician inside. Then we also mentioned the site visit that we conducted to the health facility, and we also capture context because it helps us think about how to design. The picture on the left has medication and some charts on the wall. The picture on the right has some books. And I mentioned that quickly, if you are going to build technology, on the right, you would simply see books and think records because technology is very advanced. We have AI, so you can search this information online. So if you're going to build an application, it should help the clinicians to go through this information very quickly. How was technology being used, and what is the ideal type of technology that the local community found? On the chart here, you can see good medication dispensing practices by the government and USAID in terms of a diagram. All that can be automated based on feedback that we collected from the health facility. The healthcare facility, so clinicians and nurses, they said they wanted integrated tools, a tool that can collect all patient data and also help with medication. So something that simplifies all this manual process of reading information on the walls, reading information on the books, searching information on the web. So that would speed up practices. And then currently there were all sorts of information. Some information is written on paper, other information is captured on some mobile device because this community had community health volunteers who would go into the county to help with HIV, but that is treating one condition. Now to add hypertension, that would need something else. So building all this together and having patient history in a central place was important for them. And that was important because currently they were using both digital, like I mentioned, the community health volunteers are going to the community with iPads to collect information about people with HIV. In the facility, there's paper records. You can see here in the pharmacy, there's records for every patient. So there's different sets of technology that needs to be put together to help the pharmacy know that patients are actually taking their medication. So what does that mean? That means there's a gap because once you capture this information from your users, in our case it was the health facility, we also have to see how is this implementation being done locally. Locally, in the management of HIV, this community was very strong and they had a lot of things going on. For example, people who had HIV would work together and have some income generation activities. So I did not mention that in the talk, but that is important because that context of community helps them support each other. So in the management of hypertension also, if local groups are formed around some information sharing, that can help people remind each other on better eating practices, better farming practices, better food practices, and address the issues around hypertension. So chronic conditions are things like hypertension because you have them for the rest of your life. So then we tie that to overall research to tell us that this is a serious problem. And for this slide, I just said this is a serious problem, is affecting 46% of Africans over a certain age. And in Kenya, the biggest problem we have is we have less cardiologists for more people. So that means one cardiologist per 1 million. This is a study that was done in 2017, 2018. So maybe the numbers are better, but it still shows that technology can help bridge this gap so that if a cardiologist gives information, it can spread to most of the population. So then we moved into the opportunity. In the context of healthcare, we said hypertension is a major cause of heart disease and stroke. A lot of Africans have smartphones, and with these smartphones, we have a percentage of Kenyans that live in rural areas, and most rural areas don't have cardiologists. Hence, if we had technology, it could advance information from cardiologists and help people live healthier lives. This is used, like I mentioned, human-computer interaction is about designing technology for context. So now this slide is contextualizing. It's putting within context the work we are trying to do. We are doing something in healthcare. It is important for this rural community, but this slide shows it's even a bigger problem in health. It leads to heart disease and stroke. But there's some technology called mobile phones that people have access to. And some of the people who have access to this medication, a big percentage of them in Kenya live in rural areas. So that means this technology, smartphones, is key to addressing issues around hypertension in Kenya. So that is the meaning of this slide. And then this slide is just an opportunity. It's saying if we can transfer the management of health. So let's say you have hypertension and it's serious, you will fall to the red right part, which means it will be expensive to treat it. It will cost $10,000 a day internationally. But if you shift to the left and you're able to use information shared using design technology, for example, the cardiologists are able to speak to you and help you improve your lifestyle using this application we could build, it becomes very cheap. It's less than $1, which means it's just you follow behaviors that the technology can share. That is what this slide is explaining. So we said that the solution would be supporting cardiologists share their information with users in a way that is low cost, and then use information that you collect with users over time, because this will show if people are improving. That is what we mean by hypertension trends. And then patients are connected to experts based on how serious their problems are. So that would mean if you do what is recommended using the application that is built, your health should do well. If that doesn't happen, based on the records that are collected, the experts are able to monitor how you are going, and they can tell if your situation is getting worse. So this would be through connection of these technologies that we are speaking about. Then we said when you conduct interviews like this, you write research papers. But for what we are doing this week, we do not need to write a research paper. So we skip that page. The next part, based on the diagram and based on the steps, would be iterative design. So as you see here, the iterative design is supposed to help us build a healthcare system and show how the prototype is built based on information that we have covered from the link. So there's a typo on the top box, but the point is we are building the healthcare prototype based on information that we have collected with the interviews. Then we designed the medication management companion. What is the medication management companion? This is an integrated desktop and mobile application that is designed to help individual patients take medication, because we are looking at two sources of issues. We are looking at how the health communities already using technology to solve HIV. We are adding hypertension. So this companion is able to help people who have hypertension and HIV in some cases to manage those conditions. So then we had to capture also the hypertension prescription process. And we said if you go to a clinic and the ideal situation, all your records exist, then the patient history exists, yes. The clinician is able to get your patient records and prescribe medication, and you will live very quickly. The problem gets complicated if your records do not exist. Do they exist in other institutions? Can we look for them? If they exist, that is fine. We'll get your profile and get your records. But if they don't exist in another institution, and based on our experience in our research, the practitioner would speak to the clients or the patients and ask them, what type of medication are you taking? And sometimes if the patients were very old and didn't remember, but they had the container, that would mean the clinician will just ask, and how are you feeling now? Based on the drug they are taking and how they are feeling now, he could generate a profile. If that does not exist, then they would ask questions like, who else in your family has such an issue? Did your grandparents have this issue? Do your siblings have this issue? All that information is used to generate a profile and bring patient records. So patient records are very important in terms of medication prescription and treating chronic illnesses. The point about all these slides was collecting information. It does not have to be as complicated as a healthcare. It could be anything. You could go to the market and collect information. You could go to the local chief office and collect information. There's many things we can build in society. So it doesn't matter what information you're collecting. You just need to know, in this page, you want to prescribe medication and you want patient history. In your case, your project will do that. The project will have a start, what you're looking for, and what you're looking for in the end. The path in the middle will take all forms of paths that you can find. But you want to know how is this technology going to make it easy. So if we had a technology for hypertension and it was able to collect patient history, everything to the right would be solved. That's what it means. And then we captured, this is just a design capturing the users. It's capturing the community health volunteer with the tablet collecting information from the patients with chronic illnesses, so they don't have to come to the facility. And once information is collected and it's sent through the internet or other means, the nurse is able to see it. So sometimes these old people don't have to make trips to the church, to the clinic. Then today, the challenge we have is there are few cardiologists, but there's several health facilities. All these people, all these hospitals and patients who are coming here cannot read the cardiologist. So if the cardiologist information can be captured in technology and brought downwards, that would solve this challenge. And then this is the data flow, and we say this is just the information that is collected. The community health volunteer is collecting information about patients. The cardiologist is collecting information about the patients and doing some tests. And then on the left, the health facility contains the data and treatment records. And then in the bottom here, we just have all sources of data. And then we say the treatment flow. This is captured in the diagram that we have here. So this diagram is the same as this diagram. So all that information is used to develop a product prototype. And you want to ask your question. You want to ask your users some questions. Will they use the product? How can we tell them the value of the product and what are they saying, which is user feedback. On the right are some methodologies that you can use to test this information. You can conduct interviews, you can conduct surveys, you can speak to them and others. These are just examples. So then, based on all that information, the diagram you see on the right is just showing the success of Luala in its HIV projects. So because of that success, we were relying on their use of technology to help inform hypertension treatment. So what did we think should work? So we are saying the role of community health volunteers should handle comorbidity. This just means they need to be able to add information about hypertension to what they're already doing, so that we don't create for them a new job or a new whole path of things to do. That is why we said we want to understand current community practices and behaviors. So because they are already going to the community to collect information about HIV, they can add a few questions about hypertension. And also train them, provide them with different training. You remember we said there's few cardiologists. So if the cardiologist training can be put in the technology, the community health volunteer can see it. So this way they are able to translate information that the cardiologist cannot tell 1 million Kenyans, and now they can tell the Kenyans who they interact with. The other thing is we need to access patient data to help with treatment. It is important to be able to manage chronic conditions. The clinician or the doctor needs to know which medications have you been taking for, let's say, the last 5 years. So the technology should have, you can see it say data-informed treatment. So data-informed treatment means I'm looking at your data and I can see your patient history. That helps me solve your problem accurately and quickly. If we keep going to different facilities, it complicates the issue because some of your records are missing. So then we are saying data is needed to understand, monitor, and manage patients' conditions. So then we designed a tool that was able to strengthen ties between patients and practitioners. The patients are the practitioners, which are the clinicians. They need guidelines based on prescribing medication. These guidelines come from the cardiologist. When they're digitized, the cardiologist has no problem because the clinicians who are in the rural facility, and you remember we only had 48 cardiologists in the country, the 48 cardiologists sit down and give guidelines, and also the government give guidelines. All these guidelines are on a lab, all on a technology device. So it could be a tablet. That tablet, if you give it to the clinician is seeing exactly what the cardiologist would do. Then they would use that to prescribe medication. And the app would help patients remember when they want to take medication. And also the patients can say, I'm feeling unwell, and this information can be collected and taken to the facility. So then we can also reduce how many people go to the facility to just report symptoms. That prototype was presented in a conference, and we are not going to do that this week because we only have 5 days. And then finally, we built an application. This application is the third step, and it's based on user feedback. Once you build and people can interact with it, you remember in our initial diagram we spoke about interaction. That leads to continuous improvement. And you remember I mentioned the example that when you use, in the past, people would not be able to reverse M-Pesa transactions, but later, after collecting feedback, they were able to reverse. That was a sign of a well-designed human-computer interaction application improvement. They improved it and added security features. So that gave us the final application, which was the mHealth, and this is how it looked. It captured patient history, it provided information, and it collected some data for the patient. Once the clinician opens this data, they have the patient history, and this improves their treatment. And then finally, here are the 3 steps combined. On the left, we have collected information. That gives us design input. In the middle, we have built the design and tested it. That gives us the medication management companion. We called it medication management companion because you remember the clinicians were already using technology to capture information about HIV. Then we added hypertension. So we built technology within context and used the behaviors of the local facility. That we got more feedback, improved it, and built the application that now was tested at the facility. This whole circle of conducting user interviews to gain information that informs the design iteratively, which means rotatively, which means small incremental steps, led to the design of a prototype that users can interact with. Further feedback improved the prototype to an actual testable minimum viable product. So we have the facility up there, we have the solution, and we also added another feedback because we mentioned that if we come back here, you remember we said the patient app, if the patient provided some information, they would not need to go to the facility. So now if we come here, you see the patients could actually chat with the facility and provide information and even make appointments, or if it was just replacing of medication, the community health volunteer would also come with the medication. So that simplified visits at the facility because the facility was serving 30,000 people a month. So if some of them could reduce, that would be perfect. Then we come back to where we started. Human-computer interaction involves users. In our case, the users were the health facility clinicians, nurses, pharmacists, and community health volunteers. We used them to design an application that could help them capture patient history. That design led to a prototype which the users could interact with, and that led to the MVP, which was the technology. So the humans, the health facility stakeholders, and the community members who are the patients helped design the management MMC. The MMC is this one in the middle. This is the MMC, medication management companion. And then they designed the minimum valuable products, MVP. Here it is, the MVP. All that was possible through feedback and testing. So this week we're going to look at projects, and we said we want to look at research. We research a little bit about information that we know. We are going to form teams. We said we're going to form about 8 teams. These teams should be cross-functional. They should have every skill so that everybody is able to participate from tomorrow. Then we said whatever you want to think about in the problem area, so whatever problem area you fix, how are people solving the problem now? You want to read a little bit about that. And then we also said we want to apply research insights into building an MVP. In our case, this was the MVP, the diagram on the bottom left. But how we got to the MVP, we mentioned you start with a prototype. How you get to the prototype, we also said you collect information from users. But MVP means the minimum viable product, like the smallest version of the product that people can see and test. So then we summarized and said, by understanding users in their setting, that is what is called by contextual users. If you understand users, you're able to build for them solution. So because we're in the era of AI, the focus of our whole project since from today until Friday would be to help design meaningful user experiences that can support designing solutions that we can use around us. The other thing I've forgotten to say is I mentioned ICTD. So that was in information communication for developing countries, so developing technologies for our areas. And the reason why I have to mention that is because up here when we were introducing the talk, I mentioned ICTD. You can see it here, contextual understanding of ICTD, information communication technology for developing countries. We are building solutions for developing countries. Our solutions are different. They need to work locally. So that is why HCI becomes very important. So based on that aspect, I also spent time and then said that I'm going to make this deck. We didn't record the deck, but now I've recorded it. This deck, I'm going to put it on YouTube, and then it's going to be in the community. So each and every person in the course, go to the YouTube page after watching this video and subscribe there, because when you're there, you will be able to ask questions clearly, and we are all going to be on the same page. We don't want anybody behind. We don't want assuming, and don't sit in the group and let other people do things, because you will have nothing to say on Friday. So again, everybody go there. We have a profile of students. Like I mentioned, I'm going to meet with Ted after making this video and uploading it. And then I need everyone to be participating. And this video, I've recorded it so that you are able to go back to this video and actually ask a question in what you do not understand. This course is hands-on. You cannot do it if you don't do these things I'm mentioning to you. So thank you very much, and I'm looking forward to your questions today as we go into tomorrow. I'm uploading this video in the next few minutes.